Welcome back, everyone. It's so good to see you again. Today, we're going to be talking about public health policies around infectious diseases, human behaviors that contribute to their spread, and the importance of vaccines. Let's jump in. Public health policies are crucial to prevent infectious disease outbreaks and epidemics. Breakdown in public health measures such as reduction and prevention programs, inadequate sanitation, and vector control measures are factors leading to the emergence of infectious diseases. An example of this is the resurgence of TB in the U.S. between 1985 and 1992. The resurgence in TB cases between 1985 and 1992 can be contributed to at least 5 factors. First is the inadequate funding for TB control and other public health efforts. The HIV epidemic, increased immigration from countries where TB is common, the spread of TB in certain settings, like correctional facilities or homeless shelters, and the spread of multi-drug-resistant TB. The overall decline in reported TB cases since 1993 may be attributed to the increase in resources used to strengthen TB control efforts. The increase in federal, state, and other funds and resources allowed TB programs to improve their control efforts to promptly identify persons with TB, start appropriate initial treatment for TB cases, ensure patients complete treatment, and conduct contact investigations. The isolation and treatment of symptomatic individuals, coupled with quarantining of individuals that have a high risk of have been infected, are 2 commonly used epidemic control measures. The Advisory Council for the Elimination of Tuberculosis and the National Tuberculosis Controllers Association encourage public health officials and healthcare workers to assist in development, implantation, and evaluation of TB screening, testing, and treatment for both latent TB infections and TB disease, establish priorities for prevention and control activities, protect the public's health by isolating and treating persons with TB disease, and involving other healthcare providers in screening, testing, and treatment and preventative treatment activities. So, how do we spread tuberculosis anyway? First, it's important to know that tuberculosis is not spread by shaking someone's hand, by sharing food or drinks, touching or sharing bed linens or a toilet seat, sharing a toothbrush, or kissing. The tuberculosis bacteria are put into the air when a person with the TB disease of the lungs or throat coughs, speaks, or sings.
Oh yeah, I was talking to my boy John. He says 5G towers are causing Ebola. Yeah, crazy.
Now let's talk about different human activities that can contribute to the emergence of infectious diseases. Cross-border movements of people, as well as trade in goods and services, are increasing the challenges for infectious disease control. Some good examples of these are Ebola, COVID-19, and SARS. 940 million international journeys were undertaken in 2010. Global travel on this scale exposes many people to a range of health risks, such as different disease agents and changes in temperature, altitude, and humidity, which all can lead to ill health. Trade and international travel are essential to humankind, so make sure you take precautions before, during, and after to travel and stay safe. Changes in the environment, including food handling practices, agriculture, and changes in water ecosystems, seem to increase the chance of contact with the reservoir host, encountering microorganisms previously unknown to humans. Examples of this is Campylobacter and non-typhoidal Salmonella. Make sure you educate yourself on food and water safety to avoid these types of diseases. The interface among humans, animals, and the environment we share can be a source of diseases impacting public health. There is circumstantial evidence to suggest that novel epidemics and disease syndromes are the results of changing agroecology and human behavior and movements, intensifying interfaces with certain wildlife species and climate change. Examples of these diseases are Ebola, and Marburg. The process by which infectious agents may transfer from animals to humans or disseminate from isolated groups into new populations is called microbial traffic. These zoonotic diseases can be avoided by washing your hands, preventing bites from mosquitoes, ticks, or fleas, educating yourself on how you can stay safe around your pets, and avoiding bites and scratches from other animals. It has been shown that antimicrobial resistance is the consequence of microbial adaptation and genetic changes that allow them to bypass the human immune system, infect human cells, and spread disease. These microbes can emerge and spread rapidly and become resistant to multiple antimicrobials at the same time by developing mechanisms to exchange or incorporate new genetic material into their gene, exchanging virtually any stretch of DNA or RNA. An example of this is Staphylococcus aureus. Human susceptibility may influence the emergence of infectious diseases through genetic polymorphism, impaired immune function, malnutrition, AIDS, immunosuppressive conditions, aging, and other factors. Innate and acquired immune defenses help humans to fight against infectious diseases. Healthy living is a great way to prevent disease, so don't forget to eat healthy, exercise often, limit your alcohol, quit smoking, and reduce your stress. Human behavior changes are often linked to culture, which refers to integrated patterns of human behavior that include the beliefs, language, communications, actions, and organizations of racial, ethnic, religious, or social groups. Many infectious disease outbreaks sensibly spread because of these factors. Since the occurrence of HIV/AIDS and Ebola, for example, stigmatization, discrimination, ignorance, trust, and misinformation have been the root of the spread of these diseases.
All I'm saying is pigeons aren't real, man. Have you ever seen a baby pigeon?
I mean, no, but I'm pretty sure.
Go
it's
ahead
real.
and
What?
Google baby pigeon. You're not gonna find, dude, they're robots. They're spreading tuberculosis. Dude, TB stands for the birds.
Dude, I don't know. My cousin said 5G towers are spreading tuberculosis.
Dude, that's the most ridiculous thing I've ever heard.
Dude, yeah, 5G towers and Bosnians. They're chiefly responsible for what's spreading it.
Dude,
I just read that in the paper, bro.
no way, man. Dude, I read in The Onion that tuberculosis is directly coordinated with pigeon farts.
I've heard of the Onion.
Yeah, it's a totally credible source.
Yeah, that's crazy, dude.
Make sure you watch out for any misinformation online or on the news about infectious disease. Always listen to your doctors or scientists about any and all updates on disease prevention. And remember, vaccines protect you and your family from many serious and potentially deadly diseases. They protect other people in your community by helping to stop diseases spreading to people who cannot have vaccines. While they might cause mild and short-term side effects, they're safely tested for years before being introduced into the public and reduce the rates and even get rid of some diseases altogether if enough people are vaccinated. Thanks so much for tuning in, and remember, stay safe, healthy, and
Vaccinate your kids!
big shout out for Frank and Danny for helping me out, and an even bigger shout out to Dr. Ramirez for making this microbiology semester so much fun. I can honestly say that I have not had this much fun with a STEM class before, and just the fact that this was online and this was such a hard semester already, she made it so easy and so much fun to take this class with her. So big shout out to her, and thank you for the amazing semester, and thanks for some really fun video projects that came out of it.